welcome to channel. In our last video we have discussed about coronavirus disease 2019 COVID-19 precaution and more. In this video we will continue with coronavirus disease 2019 COVID-19, self-isolation methods and more. Transmission of COVID-19 depends on many factors, and the basic reproduction number can be lowered by engaging in outbreak prevention measures such as physical distancing and self-isolation upon experiencing symptoms. Self-isolation at home has been recommended for those diagnosed with COVID-19 and those who suspect they have been infected. Health agencies have issued detailed instructions for proper self-isolation. Many governments have mandated or recommended self-quarantine for entire populations living in affected areas. The strongest self-quarantine instructions have been issued to those in high-risk groups, those who may have been exposed to someone with COVID-19 and those who have recently traveled to a country or region with widespread transmission have been advised to self-quarantine for 14 days from the time of last possible exposure. Containment and mitigation for coronavirus disease 2019 COVID-19. Strategies in the control of an outbreak are containment or suppression, and mitigation. Containment is undertaken in the early stages of the outbreak and aims to trace and isolate those infected as well as introduce other measures of infection control and vaccinations to stop the disease from spreading to the rest of the population. When it is no longer possible to contain the spread of the disease, efforts then move to the mitigation stage. Measures are taken to slow the spread and mitigate its effects on the healthcare system and society. A combination of both containment and mitigation measures may be undertaken at the same time. Suppression requires more extreme measures so as to reverse the pandemic by reducing the basic reproduction number to less than 1. Part of managing an infectious disease outbreak is trying to decrease the epidemic peak, known as flattening the epidemic curve. 453. This decreases the risk of health services being overwhelmed and provides more time for vaccines and treatments to be developed. Non-pharmaceutical interventions that may manage the outbreak include personal preventive measures, such as hand hygiene, wearing face masks, and self-quarantine. Community measures aimed at physical distancing such as closing schools and cancelling mass gathering events. Community engagement to encourage acceptance and participation in such interventions, as well as environmental measures such surface cleaning. More drastic actions aimed at containing the outbreak were taken in China once the severity of the outbreak became apparent, such as quarantining entire cities and imposing strict travel bans. Other countries also adopted a variety of measures aimed at limiting the spread of the virus. South Korea introduced mass screening and localized quarantines, and issued alerts on the movements of infected individuals. Singapore provided financial support for those infected who quarantined themselves and imposed large fines for those who failed to do so. Taiwan increased face mask production and penalized hoarding of medical supplies. Simulations for Great Britain and the United States show that mitigation, slowing but not stopping epidemic spread, and suppression reversing epidemic growth have major challenges. Optimal mitigation policies might reduce peak healthcare demand by 2/3 and deaths by half, but still result in hundreds of thousands of deaths and health systems being overwhelmed. Suppression can be preferred but needs to be maintained for as long as the virus is circulating in the human population, or until a vaccine becomes available, if that comes first, as transmission otherwise quickly rebounds when measures are relaxed. Long-term intervention to suppress the pandemic causes social and economic costs. Treatment for coronavirus disease 2019 COVID-19. There are no specific antiviral medications approved for COVID-19. but development efforts are underway, including testing of existing medications, taking over-the-counter cold medications, drinking fluids, and resting may help alleviate symptoms. Depending on the severity, oxygen therapy, intravenous fluids, and breathing support may be required. The use of steroids may worsen outcomes. Several compounds that were previously approved for treatment of other viral diseases are being investigated for use in treating COVID-19. The World Health Organization also stated that some traditional and home remedies that can provide relief of the symptoms caused by SARS-CoV-19. Healthcare capacity against coronavirus disease 2019 COVID-19. Increasing capacity and adapting healthcare for the needs of COVID-19 patients is described by the WHO as a fundamental outbreak response measure. The ECDC and the European Regional Office of the WHO have issued guidelines for hospitals and primary healthcare services for shifting of resources at multiple levels, including focusing laboratory services towards COVID-19 testing, cancelling elective procedures whenever possible, separating and isolating COVID-19 positive patients, and increasing intensive care capabilities by training personnel and increasing the number of available ventilators and beds. In our next video we talk coronavirus disease 2019 COVID-19 further development around the globe.
Press the bell icon on the YouTube app and never miss another update.